Hi, I'm Kevin Slee. The doctor's role really is to help the injured worker recover in a physical sense, be aware of the psychosocial elements that can also impact on a worker's experience of their injury, and then negotiate with the employer to find suitable duties that a worker may be able to do with the physical restrictions that might be appropriate for a particular injury while the injury is recovering. So I think a doctor really is central to all of this, and it's all about good communication. There is good evidence that returning to work early after injury, or even remaining at work after injury without having any time off if you possibly can, is good for the recovery process. The WorkCover Certificate of Capacity is the central document that a doctor fills out. It is the mechanism by which a doctor certifies that the person named on this certificate has these particular symptoms relating to this particular injury. Also, further down on the certificate is the doctor's certification about what the injured worker can do, what his patient can do. What the employer then does is look at those restrictions and see what duties are available in the actual organisation that this person may be able to do within those restrictions. I think in a work-related injury, an employer's input really early on is so important. I've seen time and time again that when an employer has an active input early on in the injury, the outcome is better. If the employer can at least send a letter and in that letter outline what alternative duties may be available for the injured worker, better still, around your workplace, if you've got photos of things that you can take, photos of processes or other jobs, and accompany those with the letter to the doctor, that would help. Some people even go to the point of making a short video, DVD or something that a doctor may be able to put into their computer and view that. And that's fine if it only is going to take a minute or two. I really do suggest that an injured worker suggest to their doctor things that they may be able to do at work. That's being really proactive. If we can get the message across to our patients, to our injured workers, that they bring the expectation to the consultation that a doctor will ring their employer during the time that they're sitting with them, and expect that the doctor will facilitate their return to work, not only will we get better return to work outcomes, we'll get happier people.